Welcome to Direction Northeast. Hello, I'm Ashley Baker. This program is a presentation of the Communications Department of Northeast State Community College. This episode of Direction Northeast is about the teen suicide prevention. We'll start our discussion following these messages.
What if there was a place
where your mind is nourished,
your time respected,
a place where you don't feel lost in the crowd,
where you get the attention you need
and deserve?
What if that place is right here, right here?
Right here, all along.
Over 80 programs of study,
a main campus,
and convenient teaching sites.
Unlimited potential.
Right in your backyard.
Northeast State.
Northeast State.
Northeast State Community College.
In the year 2009, there were 44 teen suicides in Tennessee. In 2010, there were 38 teen suicides in the state. Though the rates dropped slightly, even one teen suicide is too many. The state of Tennessee funds the Tennessee Suicide Prevention Network as a means of educating the public about suicide. TSPN works across the state to eliminate the stigma of suicide and educate communities about the warning signs of suicide, with the ultimate intention of reducing suicide rates in the state of Tennessee. This episode of Direction Northeast State takes a look at this program of teen suicide and how TSPN is working to save lives. As we begin this program, let's welcome two guests who work with TSPN. First is Harold Leonard, the Regional Chair of the Tennessee Suicide Prevention Network for the past 6 years and former Chair of the Advisory Council. Mr. Leonard is currently licensed professional counselor in private practice in Kingsport and serves on the Board of Contact Concern. Next to Mr. Leonard is Dr. Tim Perry, a licensed professional counselor with mental health service provider status. Tim has a doctorate of theology and a master's of counseling. Tim has been in the field of mental services for children for more than 20 years and has worked with the therapist, case manager, clinical supervisor, teaching, and consultant. Gentlemen, welcome.
Thank you. It's nice to be here.
How big of a problem is teen suicide in Tennessee?
Like you mentioned, it has gone down slightly in the past few years, and we like to think that that's due to a lot of the efforts that we've been doing. Tennessee Lives Counts is a program that's part of Tennessee Suicide Prevention Network that has been working directly through a lot of the school systems and other areas in the state to reduce it. And it is a problem, like you said in the beginning, one is too many. And unfortunately this year we've had quite a few suicides of teenagers in high schools across the state, and we've had to go in and do some postvention work.
What is the TSPN and how does it function?
TSPN it's a group of volunteers across the whole state. There's just a couple of paid professionals in Nashville who organize the program, and then the rest of the people are just volunteers. There's hundreds of volunteers all across the state. And Tim is one that helps us out sometimes as well. And it's just people who are interested, anybody from the community that's interested in helping out.
What kind of success rate or measure of success does TSPN have?
Would you like to answer that?
Well, it's hard to measure success because of the number of kids that we don't know that may have thoughts about suicide, and because of education and the work that TSPN is doing and the interventions actually never followed through with the suicide. So, you know, when we see suicide rates decreasing, we hope that the efforts that TSPN has done across the state is part of that reason. But it's very difficult to measure how wide a success it is when we don't know how many kids have thought about it, but with interventions actually never followed through with the suicide.
You don't know how many you're dealing with. Is there a phone number or anything that someone could call to talk to or go to the?
Yes, the National Suicide Prevention Hotline is 1-800-273-TALK. 1-800-273-TALK.
And TSPN works across the state to eliminate the stigma of suicide. How do you address this problem?
One of the things that we encourage people to do is not fear talking about suicide. One of the major barriers, it seems, that we have run into with people when it comes to suicide is just the fear of saying suicide or asking someone about suicide or even mentioning that. So we're trying to instill in people through education that overcoming that barrier of fear and that willingness to actually address it, to talk about it, to bring it out in the public, and to let people know this is a reality and there are things we can do about it. And we have some means to which we can address this problem. So overcoming that fear is a huge issue that we're dealing with.
And you were mentioning about teen suicides as well. That's been a big fear in the school systems, is that they want to just keep it quiet. They don't want anybody to talk about it once it does happen. And unfortunately, that's the wrong thing to do. We need to take that opportunity to educate everyone about what's happened and how to prevent further suicides.
Much has been spoken lately about the harmful effects of bullying. Would you say bullying is one of the major causes of teen suicide?
I think bullying definitely is one of the factors involved in teen suicide. I think it's gotten a lot more attention recently, but it's always been there, really. It's just something that we're paying a little more attention to lately. What do you think?
Bullying, yeah, I agree, Harold. Bullying has always been an issue that has led to stress and other factors. What we have now that is kind of new, I guess, in the last few years is the cyberbullying, where kids can't get away from the bullies. When a bully was at school, you went home and maybe you could get away from that. With cyberbullying, it's everywhere a child is, so children often feel they can't get away from that, and that stress and that intimidation and that inescapability of the bully often leads kids to do some drastic things, and sometimes those drastic measures end up in life-harming things.
And they can be 24 hours a day.
24 hours a day, yeah.
And other people may not even be aware of it because it may be happening on the computer or on their phone.
Right.
What would you recommend to someone who is being cyberbullied?
One, they need to talk to somebody. Don't let the fear of telling someone that you're being bullied stop you from actually discussing it with someone. Tell your parents, tell your friends, tell a teacher at school. Let others know what's happening so that they can help guide you in making right choices. Have some monitoring on when you're on the media, electronic media. Don't respond. Don't get engaged in a conversation with those who are trying to use intimidation and trying to use tactics to cause you to feel, bullied.
Has the lack of cultural diversity in our society contributed to higher suicide rates, would you say?
That's not something I've thought about too much before. For one thing, the number of suicides tend to happen more among whites than among any other races. And as far as cultural diversity goes, it tends to be more among English-speaking. I think there's not a lot of data about other cultures as far as Spanish-speaking, for example, or they tend to not go for counseling more than other groups.
The white race tends not to go for counseling?
No, the white race tends to go to counseling more. Other ethnic groups tend to not go to counseling as much or to report things as much. So I think that there's an area there that needs to be addressed and looked at further.
There's a lot of, in our schools, there's all kinds. What would you recommend to people that were not being open about it? Would you recommend them go to their friends? Who would be the number one to talk to?
Your school counselor, a school teacher, a trusted, if you're talking about elementary and high school, a trusted adult, someone that you feel that you have confidence you could trust, or to a peer. It's better to talk to someone than talk to no one.
Yeah. Much of your work is concerned with training third parties to recognize symptoms of those who are thinking about suicide. What are some behaviors we could be watching for to recognize maybe they would be thinking about it?
Well, there's quite a few. There's social isolation and withdrawal. Typically, it's a change in behavior if somebody has been more socially active and involved in things, and then there's a change and they're not interested in things like they used to be. A loss of interest in stuff that normally they would have been involved in, and they just don't want to do those things anymore. Sleep disturbances, appetite disturbances.
A big one is if they start giving away personal possessions, things that mean something to them. If they start taking care of the affairs of their life, doing a will, maybe doing things out of the ordinary, an increased interest in things like religion or a decreased interest in it. But one of the big ones to look for is if they're doing something that says, I'm saying goodbye, giving something to somebody that means something to them, that's saying this is something you can remember me with.
And in this particular age group too, I think it's important to remember that substance use is very clearly connected to suicide. There's many people who die by suicide have been using and abusing substances.
Mr. Perry, what should we do if some of these behaviors we recognized some?
Well, that's kind of where QPR steps in. The first thing is to question, ask. You know, there's two ways you can ask. You can ask directly or you can ask indirectly. Indirectly would be, are you thinking of, you know, that you don't want to go on living anymore? Are you thinking that life's too big for you? Or are you having thoughts that you'd just like to fall asleep and not wake up? More directly questioning them, just simply asking, are you thinking of killing yourself? Or have you had thoughts of suicide? Have you had thoughts of ending your life? I've noticed you seem more distressed, more depressed, and I'm concerned about you. I'm worried about you, and I need to know, where are you? You know, what's going on with your life? Are you feeling like you want to end your life?
Something distant, seeming distant.
And offering hope, I think, is very important for that person, because
Yeah.
they're generally feeling very hopeless, that there are no other solutions, that they've come to the conclusion that that's the answer to their problem, and we have to give them some hope that there are other answers, that it's we usually say it's a permanent solution to a temporary problem.
Mr. Leonard, what should the person do that's encountering someone exhibiting these at-risk behaviors?
Like he was mentioning, I think it's very important to go ahead and feel like you can ask the person if they're having a problem, if they're thinking about suicide. You might want to take a time when you know that you have plenty of time to discuss it with that person, and to have them in a private place so that they don't feel uncomfortable discussing things with you, but showing some concern with you, and maybe having some other people that could back you up and help you out if you needed them.
Let you know you're there for them.
Let you know you're there for them, that you care and that you want to help them out.
One of the worst things is don't ignore it. Don't just pretend it's going to go away, or pay no attention to it, or just try to dismiss it by denying it's actually there, because the warning signs are keys to us knowing that this person is crying out for help.
You may not have another chance to talk to that individual, so it's best to not put it off.
Yeah.
Mr. Perry, when should a trained professional become involved? I mean, like you said, it's not likely for a teenager to be working on a wheel or giving things away. When should the friend step back and a professional step in?
When you've asked the question and the person indicates to you that they are having those thoughts, or they're heading that spiral downward toward suicide, then to recognize that this is a time for intervention, time to get help, to refer them to someone for professional help, sooner than later. You don't want to put that off. So it's getting that person willing to go and speak to someone in a professional capacity. But the sooner the better, and not to wait and let it go.
Mr. Leonard, one of the listed strategies for reducing the suicide is to improve the access to the community linkage with mental health and substance abuse services. How do you work to reduce these suicides?
To link with all the services and everything. Unfortunately, many people don't know where to go for help. So that's one of the things that we're trying to do across the state, is to educate the public that there is help available, there is hope, there is help available, and it's in your community, and to let them know what community agencies are available, what programs are available. Most of them don't necessarily require money, or they may take insurance, and we give them all that kind of information when we do the suicide prevention training, and go to community fairs and things like that to let people know where they can access it.
So I've actually had a friend that I noticed maybe towards leaning that way. He went more towards the alcohol. Is that common?
Yeah, yes, it is actually. Oftentimes, we are equipped with an innate desire for survival, and many times to overcome that barrier of that desire for survival, we need something that, or a person thinking of suicide wants something that will help them overcome that, and they will take alcohol or drugs that eliminates that resistance, and sometimes eliminates that kind of barrier, and often gives them the willpower, so to speak, to carry out and go forward with suicide. Remember, suicide is a coping mechanism, a negative coping mechanism, but it's a coping mechanism, just like alcohol and drugs is a negative coping mechanism. So they're very much tied together.
What would be a positive coping mechanism?
Talking to someone, oftentimes getting the correct help. Depression is the #1 symptom that leads to suicide, and recognizing that depression is treatable. There is help available for it. Getting to the right professional and talking to them and getting the right course of treatment for that disorder, that's the right coping mechanisms.
Would you say that the suicide rate has increased or decreased because of the economy today?
The actual rate of suicide in Tennessee increased up. The peak was in 2008, and it's gone down some since then. And of course, the economy started going really bad around 2008 as well. So there may be some connection with that. I don't know that that's definitely connected, but it is
People
interesting.
losing jobs.
Right, it is interesting. People not only lost their jobs, but they lost insurance benefits, so they weren't able to get the counseling sometimes or afford the counseling that they may have needed. And so I think it had a big impact on the number of suicides, unemployment, job loss.
Would you say that any is work-related with suicide at the job?
Any is work-related?
Losing their job, would you say that would be a trigger?
It certainly can be a stressor, definitely. Any kind of stressor like that, losing your job, the death of a loved one, often somebody who's lost someone to suicide puts them at higher risk of suicide as well. Any kind of big stressor and change in your life definitely can put you at higher risk of suicide.
Mr. Perry, what would you say would be the #1 thing someone would go to thinking about that? I mean, the negative, alcohol,
Well,
corner, you know.
Again, if you're dealing with stress, you're looking for coping mechanisms to cope with the stress. And the negative coping mechanisms are drugs, alcohol, self-harming behaviors, something that would help you externalize the internalized stress that you're experiencing. Of course, the positive of that is finding someone to talk to about it, finding correct help, learning better ways to deal with stress than the negative ways. So, yes, people tend to go sometimes to the negative.
Having positive social interaction with other groups, being involved with church or things like that could offer more better environment.
Clubs, around people in general.
Around people.
Right, being around people.
Would you say that the suicide rates are different in different, like, cultural environments, rural versus suburbs, or
Absolutely.
different parts of the country?
The suicide rate in Sullivan County is approximately 17 per 100,000 people. In Hancock County, with a much smaller population, it's 58 per 100,000 people. So Hancock County, Unicoi County, Johnson County, all the outlying rural areas tend to have a much higher rate because they have less access to services. Right. They're more socially isolated, and they also tend to have higher unemployment rates. More poverty, things like that, all can be big factors in making the suicide rate much higher in rural areas.
What do you think we could do to maybe change that, to help them?
I think it's a difficult situation really to try to look at, because it involves getting more services to those areas. It involves educating the public in those areas that there are services available. That's just maybe difficult to know where they are. Helping people get transportation to the services that they need. Helping the economy in those areas. It's a really complex kind of problem, I think.
Maybe there's a way we could make them aware. How would we, in your opinion, what would be the best way to make people aware that there is help out there, there is TSPN, that they could get in touch with?
Well, part of it is like what we're doing today, getting on the air, whether it's TV, using the media, newspaper, radio, the QPR trainings that we're doing all across the state, just trying to go to different organizations. Anyone, if they want to get involved and learn more about us, they can go to our website, tspn.org, and request that they get a training for their area. We're just trying to educate everybody that we can, whether it's employers, school systems, colleges, universities, all different kinds of different areas where people may need to know about the information.
Mr. Perry, I read that you had helped with the 9/11 incident, and I'm sure that that was rough. Does it ever take its toll on counselors or, your helpers? That has to be hard hearing stories from
yes,
children.
it does. Well, we've worked for a number of years in critical incident stress debriefing and management, and worked with a number of school shootings and natural disasters like 9/11. And yes, it does. You have to consider the toll it's taking on you for your own self-help. And so we do encourage counselors to, one, recognize their limitations, recognize their frailties, and go to each other for debriefings and consultation and support.
Staff has to support the staff.
Staff have to support staff, yeah.
We have to use positive coping skills ourselves.
We used to have to,
We have to do what we tell other people to do, take care of ourselves.
Yeah.
Mr. Leonard, if someone wanted to get into this, the teen suicide prevention, what would you recommend for people wanting to get involved to help out?
Okay, that's a good question. Like I was mentioning, TSPN is just a group of volunteers. So if anybody wants to, we have a regional meeting every month at Boones Creek Christian Church at the Boones Creek exit in Johnson City. And we meet the fourth Tuesday of every month at 10:30. And anybody's welcome to attend if you want to learn more about suicide prevention. You can also go to the website, tspn.org, that has more information about how to get involved. And it also has the information about where the regional meetings are. If you missed that, it gives you more directions and the address and everything for the meetings. And just, I think, doing some things on campus would be really good too. I know that other colleges and universities, I'm not sure about Northeast State, but other places have different programs, different events on campus where they raise awareness. And I think that'd be great for students to be involved. Right, to organize some kind of event to tell the students about suicide and what they can do about it to prevent it, because it is preventable.
What would you say, is there any qualifications in particular to getting involved in this, or is it for everyone?
Anybody can make a difference. You don't have to be a professional to get involved in it. That's what QPR is all about. Question, persuade, refer is what that refers to. QPR teaches anybody to recognize the signs and symptoms and help persuade that person to get help, and then refer them to somebody that is qualified to help.
If you could see one person that doesn't have time to be, that comes to school and maybe is a mother and works, what would you recommend to them who doesn't have time to get involved in TSPN but would like to make a difference? That, being around the college campus, we see as a student people exhibiting these behaviors. What would you recommend to people?
Well, one is to just learn the basic skills of QPR. I mean, QPR is pretty basic. Anyone can learn this. It's recognizing the signs and symptoms, asking the question, helping persuade them to get help, and then knowing how to refer them. So learning those basic skills can make you a useful gatekeeper in helping someone who's thinking or contemplating about suicide. So basically anyone, just gaining the information, going to the website, looking up information, self-educating yourself, and being aware of these kinds of skills.
In your experience, is there any case that stands out more than others to you?
I've dealt with a number of suicidal thinking clients over the years. I remember one of the very first ones I ever had, and this young lady had been through a horrible life experience, and when I saw her, she was very withdrawn, very depressed, almost catatonic, wouldn't speak to very many people, wouldn't talk at all, wouldn't make eye contact. And it was very obvious that she was in a state of despair. And I began talking to her about trying to engage her in conversation. And finally just asked, are you wanting to end your life? Are you thinking that that would be the best solution for what you're feeling right now? That was the open door for her to say yes. And immediately she seemed relieved, because she actually was able to tell someone, this is where I'm at.
Get it off her chest.
Yeah, and that was the beginning for her to heal and start actually dealing with what she had been through.
Talking to someone.
Yes, and then afterwards, after we got engaged in conversations and actually began in treatment, I found out later that she actually had a weapon in her car that she had planned on going back to her car after she come in and saw me and using that weapon to end her life. So wow. It was within minutes, and she literally said this, within minutes before she ended her life that happened.
Wow. Mr. Leonard, as you're working as a counselor, what's one of the moments that's probably the best in what you do? Anything that stands out?
I think it's always very rewarding to know that people can come in sometimes feeling like there's no hope and there are no other options, and they've run out of options, and to help them find out that there are things they can do to improve their life. There is support available, and they just can't see that at the moment because they're too depressed or too hopeless. And it's just very rewarding to see that people can turn their life around and get the treatment they need.
The rewards of knowing you help someone.
Right.
Thank you all for coming today.
Thank you.
Thank you. We'll be back in just a moment to wrap up Direction Northeast.
Business, medical, and financial institutions must have confidence in the data that they use. Information assurance is the strategic use of technology and software to protect data from internal and external threats. Northeast State offers an associate's degree program designed to fill the demand for information assurance professionals. The Information Assurance program offers hands-on personal instruction. Northeast State Community College is an accredited institution offering financial aid and job placement. Northeast State, we're here to get you there.
Northeast State's a wonderful place to start your career in college, and the campus is beautiful, the teachers are one-on-one.
It was an excellent decision to come to Northeast State. I've learned so much coming here.
I love the school, and everyone is friendly here. This has been the best time of my life. I have really enjoyed being here.
I think if it hadn't have been for Northeast, then I wouldn't feel as happy and as driven if I chose another school.
Step by step, Northeast State is here to get you there. Enroll now at northeaststate.edu.
That concludes the program for today. Our guests have been Harold Leonard and Dr. Tim Perry. We have been discussing teen suicide prevention and how the Tennessee Suicide Prevention Network is working to reduce the problem of teen suicides. Community is very important to the students at Northeast State Community College, and this program takes a look at a few of the subjects they find important. Until we meet again, on behalf of the students, staff, and faculty of Northeast State Community College, I'm Ashley Baker, and this is Direction Northeast.